What are the high comorbidity rates for depression and anxiety? Have you ever wondered how often depression and anxiety go hand in hand? It turns out that these two conditions frequently occur together, with rates of comorbidity often exceeding 60%. This means that if someone is diagnosed with depression, there is a good chance they may also have anxiety. In fact, studies show that about 67 to 75% of individuals with depression also have a current or past anxiety disorder. On the flip side, if someone has an anxiety disorder, they are likely to experience depression at some point as well. Research indicates that around 63 to 81% of those with anxiety will face depression during their lives. This high overlap suggests that more than two-thirds of people with depression deal with anxiety symptoms or disorders alongside their depressive condition. What makes this connection even more interesting is that it is not random. The rates of comorbidity are much higher than what would be expected by chance, indicating a strong link between these two mental health issues. In clinical and primary care settings, over 75% of patients diagnosed with depression also have a co-occurring anxiety disorder. The types of anxiety disorders that often accompany depression include generalized anxiety disorder, panic disorder, social phobia, and post-traumatic stress disorder. Among these, post-traumatic stress disorder and generalized anxiety disorder show particularly high rates of comorbidity with major depressive disorder. When both conditions are present, they tend to worsen each other's effects. Individuals with both depression and anxiety may experience more severe symptoms and a longer duration of illness. This can lead to greater challenges in daily life, work, and social interactions compared to those who only have depression. Additionally, having both conditions increases the risk of psychiatric hospitalization and suicide attempts. The risk of suicide is significantly higher in individuals who have both depression and anxiety compared to those with just one of these disorders. Recognizing the high rates of comorbidity is essential for managing coexisting symptoms. Treatment plans should ideally address both depression and anxiety at the same time. This often means that patients will need longer treatment durations, which may include both medication and psychotherapy. Educating patients about early warning signs can also help reduce the risk of relapse. By effectively managing both depression and anxiety, individuals can improve their quality of life and overall functioning. This approach targets the overlapping symptoms and helps lessen the overall burden of these conditions. Understanding the high comorbidity rates between depression and anxiety highlights the importance of integrated assessment and treatment. These conditions frequently coexist and can significantly impact mental health and daily functioning.